My name is Herbert
This
Jones.
meeting is being recorded.
My name is Herbert Jones, and I'm president of the Townsend North Area Civic Association. Today, we're very fortunate to have Ms. Shim, who's president of Adventist HealthCare Fort Washington Medical Center. She's come out to our particular association on several occasions to talk about some of the programs they're doing over there where she is located. And she was able to share with us some time ago about the future expansion. So the folks of this meeting tonight will be to get an update on the future expansion of Adventist Healthcare Fort Washington Medical Center. I'd like to present President Shim again of Adventist Healthcare Fort Washington Medical Center. President Shim, good evening.
Good evening. Thank you, Mr. Jones, for inviting me. And I'm sorry I wasn't able to come to the last meeting because I had to travel outside of the country for a couple of days. And I was trying to see if I can do it from overseas, but I realized I'm going to be on the plane, so
Right.
I couldn't really make it. So I'm glad to be here, and I'm a bit confused because I shared this story with so many people sometimes, and in a versions iterative, we are progressing with each presentation. So I'm not really sure where this group was in terms of our plans. I feel like the last time I came to the association, we were still thinking of building the hospital at the current hospital location. I know,
Right.
Mr. Jones, you've been to conversations to know that we now have a new plan. And today I'm going to share the new plan and why that is, you know. So let me see if I can make my slides to go forward. Of course, it doesn't work, huh? There you go. So the location that we are thinking of putting the new hospital is called KDOT property. This KDOT property is right across from the New Giant supermarket that we have. And I think many people remember it as the site that was a competing bid for MGM Casino when the
Right.
National Harbor was still being built. So that is the site that we acquired, and the property, we named it KDOT. And so a lot of people ask me, you know, why aren't we building at the current site? A couple of different things that we have discovered since we met last time. First of all, as you all know, Swan Creek has an interchange planned by the State Highway Agency, and that does require us giving up some of the land to make it happen. And when that's all said and done, we currently sit on about 13 acres of a land. This is the current site that you are seeing on the left here. And we own 9.32 acres of it, and the medical office building with multiple owners own about 2.8 acres of the building. So between the two, we're a little less than 13 acres. And after we give up everything that's needed for the highway interchange plan, we will end up in best scenario with less than 9 acres, even if we are to own both sites. So we realized that it's not enough to build a new hospital. But one of the things we were counting on, if we had to do it that way, was to really be able to build high. But it so happens this site is right at the edge of a Mount Vernon viewshed. Many of you know what that is, and I don't probably need to explain, but in case you don't know what that is, it's a federal regulation that was adopted to preserve the view from Mount Vernon, George Washington's home site, as it was back when he was alive. So that means everything has to be green and in a natural state. You can't have any building that's sticking out on the horizon that he can see that looks like a modern structure. So we realized that we will be limited to about 4-story high if we are to build it on this site. So we have a very limited land, and we can go high, and it's not going to meet the demand of the community for the future. It probably will solve the issue right now and today, but it will have no room to expand in the future. So that's kind of what we have discovered. And lastly, operationally, it will be very difficult to build a new hospital while still operating current hospital on the same site. It is somewhat of a nightmare to make it happen. And at some point, we may have to restrict our capacity in seeing patients, which is not ideal. So we realized that we probably will have to build at a new site and then just move into the new hospital. That's what we thought. So this new land that we acquired is about 23 acres, and it's neighboring the Broad Creek Historic District on at least south side. So it does have some limitations, but we believe this will be a much bigger site that we can work with. So currently we're working with this site to build a hospital. So just to orient you to this rendering, here, can you see my arrow here moving up and down, Mr.
Yes.
Jones? Okay, good. So this is 210 Indian Head Highway going south, and this is Old Fort Road, and this is current Giant supermarket, right? So we're across the street from there. And we are going to be building likely just this side of the tower at the beginning, and probably add the second tower as we grow with the volume. There will be a medical office building first, probably second one. And then this is eventually, we don't need the structural parking at the beginning, but as we grow, we will eventually need the structural parking. So this will be erected over time. And that's what we are currently thinking of doing. So we have started to work with the county because it's currently residentially zoned here. We need to change the zoning to commercial. Sometimes we can build a new hospital with an exception from the residential zoning to make it happen. Downside with that is every time we need to add something, modify something, we need to go and seek that exception for each and everything we do on this campus. As you know, that could lead to many different challenges over time with people changing hands and having different recollections and memories about it, or needs changing even simply. So we learned that, it's best to have commercial zoning change accomplished before we start the project. So that's where we are. It's docketed with the county. They adopted to look into the zoning. So that's where we are right now. And we are hoping the process will somewhat be closed and concluded by the end of the year. And around that time, probably right after that, we will be filing the certificate of need the next spring, and hoping that will get through pretty quickly. Our goal is to break grounds in probably 2.5 years from now or so.
Okay.
I intentionally did not include a lot of slides. This is the end of the slide because I felt like this should be a dialogue. The other update that I have is at National Harbor. As you know, we partnered to build that medical office building, the second one that is coming up there. It's a 5-story building that has about 93,000 acres. And we're going to be leasing about 55,000 of them. So the first phase of that project, the surgery center, ambulatory surgery center on the top floor, is going to have first case sometime in early August, and it will be in full operations hopefully by the beginning of next year. There are some processes that they need to go through. They first need to do a few cases to make sure that everything goes well. That gets inspected and reported to authorities. They have to then prove and approve that we are ready for patients. And once that approval comes through, we start seeing patients. And it does take a couple of months to go through all those processes. So we'll be doing our first case probably early August, but full operation will resume around about January of next year. That's kind of where we are with the project. And then second phase of that project is going to be then building completely the fourth floor of that building out to have wound care center, hyperbaric chambers, a diabetes center, cardiovascular clinic, orthopedic clinic, rehab clinic, all on the same floor. And the last phase of that project is on the first floor to put a cancer center and imaging center there. That's kind of what we are planning to do. I don't know if anyone has any questions.
Okay, so what we're going to do is ask folks to acknowledge, to raise your hand, and then Mr. Boyer will unmute you, and then they can ask their questions. So I think we have right now, I see Ron Weiss' hand up.
Okay, so I don't see anybody on the meeting from the Conservancy, but I know their main or a concern of that area is flooding. It was an issue that made the construction of the new Giant impacted their building plans there, and that flooding in that area is always been a problem, and in any development tends to make the Broad Creek and the church's flooding problem much worse. So I wonder if you've taken that into consideration in your
So first of all, thank you for bringing up the Broad Creek Conservancy group. We are talking to them on a regular basis. We probably go to their board meeting every other month. If nothing is on the topic, but just to give an update. If there is something, we do go there more often than that. And I talk with Mr. Mike Leventhal on a regular basis about some of these concerns. And their input is going to be pretty important since we're going to be neighbors. And so we do have that conversation. I am aware of some of the infrastructural issues because of the topography and some of the delayed infrastructural improvements that's needed for the area. What we are doing is we're bringing different engineers to study the impact of our project to the area. And we will be making sure that we mitigate the flood issues from our side. I fully expect to have a retention pond as part of this project to be able to capture the storm drainage and work with the WSSC and PEPCO and all the others to make sure that we have a good plan around it. I had this conversation, I'm of a mind that project like this one is not just building a building, it's transforming the community, in my opinion, right? So we have to use the opportunity to address, some of the concerns that we have. With that said, if we try to solve every problem with this project, it will become too difficult and expensive for us to for it to take off. So we have to be considerate. But I have already proposed to the county and even the state to say it's a great project and the area needs a lot of development and help. I would love to go for federal grant, infrastructural improvement grants to address issues as much as we can. So we're partnering with the county on getting resources from the federal government to see what we can do to improve that. The unfortunate part of those grants, only the government agencies can access. Private parties like us cannot, although we're not for profit, cannot access those grants. So county has to apply for those grants and the state has to apply for those grants. So I have been raising those issues with the county and the state to say it's a great opportunity to address some of the concerns, and can we partner to apply for infrastructure improvement grants through this project? it will make it cost efficient. So I'm holding my breath because I've spoken to enough years and they seem to be all agreeing with me, but whether it goes somewhere is a good question that I'm trying to make sure that we get to be heard and there's some follow-up action on that.
Great, thank you.
Okay.
You're welcome.
I had a couple of questions. I'm looking at the scale of this presentation. So 2 questions. When are they breaking ground? It looks like they're adding additional lanes to 210. And then I was looking for Livingston Road, which is adjacent to the intersection of Oxon Hill Road. What's happening with Oxon Hill or Livingston Road?
So here is Livingston Road. As you know, Livingston Road is rural road that needs to be preserved that way. We had a pretty serious conversation with the Broad Creek Conservancy group about that. We may be able to do some things at the very beginning of Livingston Road past Old Fort Road, but I think after that, it will remain as a single lane road. With that said, we engaged a traffic engineer. Our traffic engineer is going to work with the Broad Creek Conservancy Group to make sure we fully understand the impact of traffic to the area. I know there's a concern because the area is already congested as is. So we got to come up with some creative solutions. And we are working with the traffic engineers from both sides to see how we can make the roads conditions better and ease the congestion at the same time have a thriving hospital in this location. So that's being studied carefully at this point.
The work on 210, is that just what a mile or 2 north and south? Did I see these extra lanes or these are turning?
I think it's as is currently. I do also know that there's interchange planned, although unbudgeted, unfunded at this point. So we're bringing state highway agency into the conversation with the county to think about how to plan all that together. So there's the interchange being planned on. We need to address the congestion. So this is why we have to engage traffic engineers to make sure those questions are going to be answered in a way it makes sense for everybody.
Thank you.
You're welcome. I would love to say that there will be a perfect solution, but I'm pretty sure it's not going to be perfect for everybody.
Yeah, I have a couple of questions.
Please.
If I may. So you talked earlier in your presentation about residential zoning challenges because the property does buttress some residential homes, I believe, as I look at the picture that you have up now. And my assumption is that you'll have to go through that process asking for zoning variances, or would you need to ask for that in this case?
Within the property we purchased, I believe there is no home. There may have been in the past, but I'm told there is no home. Now, the Broad Creek Cabinet Mill is going to be there. And so, but it's not our property. We just happen to own a strip of land between the Cabinet Mill and I think it's a Pepco owned small plot there at the corner.
Right.
So that is going to only serve us as an ingress for emergency traffic. So this is not a main entrance or, for public, but ambulances and delivery trucks and so on and so forth will be coming through likely.
Yeah, just a quick follow-up. One of the things our Vice President, Dwayne Boyd, has been working on, he's an infrastructure guy. Right up the street from the Giant, there's going to be 64 or 84 townhomes. So I understand, President Shim, your challenge with the infrastructure build out, which is going to be critical, as some on this call know, Ron and others have been working on the 210 issue, have outlined. And as I look at this, that's probably going to be the most creative solution that you probably have to go through, because you're talking about 2 lanes. Broad Creek has historical status. It can be very, very congested as I think about the other build outs that are occurring in and around this facility. So I just want to make mention of that. And also, what was the total square footage again? I'm sorry.
You know, when we are all done, it's going to be much bigger.
Right.
It's probably going to be around 300,000 at this point. Is the initial building is going to be around 300,000 or so.
Got you. 300,000 when you finish the build out.
Mhm.
Okay. Thank you.
You're welcome.
Do we have any additional questions? Ms. Ray? Anyone else?
May I just ask, this seems like a big improvement for employment opportunities here. Can you comment on that?
Oh, absolutely. I believe the need for people will probably increase 4 or 5 times from where we are today by the time we open. We believe our application will be 48 beds, medical surgical units, and then 12 beds critical care unit, and 12 beds what we call LDRP, that's labor, delivery, recovery, and postpartum, all in the same area, about 12 of them. With that comes a newborn nursery as well. And then we believe there will be also a requirement from the state to add a behavioral health capacity, because that's something critically needed at the state level, especially in our area. So when we are, when we work through all of that, we believe it's going to be about 95 to 100 beds to begin. Now, I know the last time when I came, I said we probably won't do OB, the deliveries. Since then, what really became highlight for all of us is that the county has about 12,400 plus 12,500 babies being born a year. Only 1/3 of those babies are being born in the county. 2/3 of them are being born away from the county. Now, if we have an access to delivery, prenatal care, and everything is good, that's wonderful. But when we look at the outcomes data, the county has a lot more births happening on the North County side, but the babies with a low weight birth, which is an indication of lacking prenatal care, are mostly happening on South County. It has more, those babies have more complications and issues from the very get-go. So it's not an ideal situation. When we think about how we have access to care, that's an interesting statistics, because majority of our residents are with health insurance that's pretty well, well covered. So that's an issue. So we have been having a lot of discussions, and the county is very clear that we need more maternal health capabilities. So there's been a request from the county and everybody else that we must plan maternal health with this new hospital. That's kind of what we got currently going.
Just one last one for me. That's good news, by the way. The helicopter landing pad for emergencies. We carry that forward from the old hospital, right?
Yeah, we just need to put an H mark on top of the rooftop.
All right.
That's given we will have a landing pad.
Okay.
Mm-hmm.
Okay. Yeah, President Shim, just a quick follow-up. So the existing facility is what's going to happen to the existing facility? Again, you may have already mentioned it, but once this plays out and once this, if it occurs, what's going to happen to the current facility?
There are some inquiries of, use of that. It's too early to tell you what's going to happen. As we get close to the time, we'll share with you more, but I do not have clear idea as to what we are going to do with it. But there is an interest to keep it as some kind of healthcare offering, given how lacking we are of healthcare access in the county.
I think Ms. Ray?
Yes, thank you. When you met with us some time ago, I was at that time very interested in your the capability of the hospital to manage stroke or provide stroke treatment care. Can you tell me, it sounds like this new facility with the diabetes center and the cancer center, that you're going to have full capability. Do you have plans for it, for having a comprehensive stroke center? We have an aging population here, elderly population, and I just wanted to know how prepared the hospital will be to handle those cases.
So let me kind of step back a little bit. When we first came into the hospital, we realized that a hospital does not have a certification or accreditation to be chest pain center or a stroke center. And getting there requires a couple different things as a pre-requirement. First of all, we have to be designated as a base station by EMS, which wasn't done prior. It takes about years worth of data to get to that certification. So during the pandemic, we got that done. We passed with the flying colors. We got 5-year, certification with no recommendations, meaning no deficiencies. And so that's it. That's the first thing we had to do. From there on, we had to collect the data for a period to apply for chest pain center and stroke center. We are almost done with the chest pain center application. Stroke center, we are waiting for one more thing that's critical to stroke care, which is MRI. You need an MRI for stroke care. We have been trying to get MRI into this current location before we move into the new hospital. I'm running into all kinds of infrastructural issues. One tells me I got to pull a second line into the hospital, second feeder into the hospital for electricity to make that happen. And I mean, there are just issues after issues after issues that we're uncovering to make it happen. But I think I finally have a solution. We're honestly pursuing to put this MRI next door to the physician office building until we move to the new hospital. Once that's done, then we can engage seriously about stroke certification. Stroke certification for most part is done. The work to get there is done. We just need to get to MRI because many of the stroke patients need access to MRI. So that's kind of what we're working on towards right now. It will definitely be here before we move into the new hospital. It's going to be absolutely be there once we get to the new hospital.
And the new hospital then will be equipped with
absolutely.
Yes. Okay.
Okay, Ron?
Yes, it's probably outside the scope of what you're doing, but based on my own experience, it's critical to have a rehab facility for once you get out of the hospital and you still need services to get back on your feet. And it took me a long time to get back on my feet after my COVID experience. And my experience indicates that there's rehabilitation facilities in Prince George's County are very scarce, and those that are available are not the highest quality. So I wonder if you can share anything you know about that.
Oh.
We lose her?
Uh-oh.
I think we lost her.
Yeah.
Oh.
Did I scare her? I scared her off.
Oh my gosh, your
She was
question
the
was so
co-host.
intriguing, Ron.
She's gone.
Oh my gosh.
Maybe her time was up.
No. Let me see if I can reach out to her, folks. Give me a second.
I'm sure she's trying to get back on
She's
here.
trying to get back. I'm sure. Yeah, absolutely. Yeah. Yeah, but that's a good question, Ron, because that would tie into what Ms. Ray was talking about in terms of stroke facility. You get the rehab part. If my wife and I use Inova, and they have a huge campus, as you all probably know, and they have everything there. The medical, you can do rehab. So when you come home, for the most part, you're finished. You've done the rehab.
Well, there are. This is Eunmee calling. Just tell me something. Hold on a minute. Yes. Did you have internet problems? Oh, geez. Well, I tell you what. Let me can I put you on voice and maybe you can hear them? Ron has a question. Someone needs to let her into the meeting.
Okay.
I haven't seen her come in, so as soon as I see her pop in, of course.
Okay, try it.
Is he trying to get in?
Yeah, she's trying to get in. Apparently, you had to be on the list or something.
No, because usually
No.
everyone that's come in, it'll pop up saying, what's the name? You know, whoever wants to join.
Let's see here.
Okay, let me do a speakerphone so you can talk directly to Herbert Jones. Okay.
Battery died, and it tells me host has joined if we let them know you are here. So when you go to the people, like participants, if you look at my.
Oh, sorry. I see. It
just
scrolled.
Yeah, I think he sees it now. Okay.
Oh, thank
There
you.
we
Thank
go.
you so much. I am so
Okay.
sorry
There
about
you go.
that.
No problem. It had scrolled down. That's what it is.
And Ron, why don't you do your question again?
Okay. Ms. Shim, this is kind of outside the scope of your plans, but my experience with getting COVID early on in the pandemic and going through rehab after leaving the hospital, Washington Hospital Center, was that the rehabilitation is a real problem in Prince George's County, and I know you know that, and I don't think we have enough facilities, and I think what the few that we have, or the few services that we have, are not the highest quality. And so while I appreciate having a full service hospital here, I think rehabilitation is another part of healthcare that we need to improve in Prince George's County. And I wondered if you could have any ideas about that.
Yeah, Mr. Weiss, I'm so glad that you brought it up. So Adventist HealthCare Rehab is nationally renowned. Actually, they're one of the few facilities that are nationally recognized for its quality. And we have acute inpatient rehab in Rockville. And everywhere we expand with a new hospital, we are building that capacity within the hospital. So it's called the hospital within a hospital. They usually rent, so to speak, from us floor or two, and then they run inpatient rehab out of that to meet the needs of the community. We're having that conversation. It's outside of what we call the certificate of need scope for the hospital project, but that is definitely in the discussion. And I'm also thinking of getting some hospice beds in the hospital as well, so that a lot of these services could be happening at the location versus us having to send patients to elsewhere away from the area. That's kind of in the discussion that we have. So as an acute care hospital, we are going to be doing medical, surgical, critical care, labor and delivery, and behavioral health.
Yeah, I didn't know whether Alan was interested in the Adventist.
Sorry, go ahead.
So that's within our scope, but we are looking into those areas that community needs beyond the scope of what we call acute care hospital to happen within the hospital wall. Mm-hmm.
That's good news. Thank you.
I'm sorry, someone was asking a question.
Yes, why don't you go ahead and ask your question, whoever that individual was?
Joan was saying something, but maybe she was saying something personally.
Oh, okay. I know the last time
It was Joan.
Okay. Last time we met, President Shim, you had a lot of demographic information about our area.
Mm-hmm.
And I know that's not the purpose of this particular meeting, but can you just briefly share sort of how we look in the scope of things in terms of the demographic breakdown?
Okay. Unfortunately, I talk about this all the time, so I know those statistics by heart. Right. So we serve about 10 zip codes in Maryland around us. that starts from Temple Hills all the way down to Accokeek over to Waldorf, I think. And we also pull from 3 zip codes in Southeast DC, but you know, for different reasons, we decided not to count them in our plan, because DC is, you know, a different jurisdiction, and Maryland planning doesn't really want us to look into it. So in those 10 zip codes, we have about 354,000 or 343,000 people, I think, that we are serving. And it's pretty large area. You know, thinking from race and ethnicity, it's about 75% African American / Black, and other 20% other minorities. So it's truly minority majority community, if you will label it at that. So we serve, you know, largely minority majority community here, and with that, number of beds available for every 100,000 is far worse off than anything you can imagine. As a matter of fact, Prince George's County has about 69 acute care beds for every 100,000 people. And as a state, we have about 152 beds available for every 100,000 people. So we're about less than half of the state. And as a comparison, Baltimore City has 678 beds available for 100,000 people. So we are serious under capacity. This is why I tell everybody around us, including our competing hospitals in the county, that this isn't about us taking your share, you taking our share. This is about elevating the county's health altogether, because you know, healthcare outcomes can only improve if you have a better access. And it is all about improving the access. And even if all of us are to do most ambitious strategic plan that we have in our mind today, it's not going to be enough to take care of the county. So we got a lot of work to do. And other interesting statistics for our area, so southwest side of the county, is over 80% of inpatient care out-migrates out of the area to DC, to Virginia, to other counties in the state. So we have a lot of work to do in improving healthcare outcomes, if these access points are any indication. I hope it answered your question, Mr.
Yes,
Jones.
absolutely. I thank you for that. That is very important, improving the access of care in our area and increasing the capabilities of our hospitals, and not having to go necessarily across the Woodrow Wilson Bridge to Virginia and Maryland. I mean, it's Virginia and DC. Absolutely. I'm in full support of that, and your vision, and to the extent that we can continue to work with you and your staff and moving this forward, we look forward to it. Do we have any additional questions? Please don't be shy. What? I'm sorry, ma'am, go ahead.
Oh,
But were you going to say something, ma'am?
oh, is that, you're talking about me? Beverly Gray. Yeah.
Oh, okay, okay.
I really don't have a question so much as I was just, you know, community programs are always very informative and very helpful, and of course, very educational to the community, to keep community members healthy and, you know, well informed. Did I hear you say that you plan to have a program of the, you know, community programs, health programs to meet the stress areas, because mental health is another major area of concern for many people. Can you just comment on that and tell us more about that?
Right. So mental health has several different components to it. You need acute inpatient care. You also need outpatient care. So, but the first thing that we must do is bring more providers to the community. And we can bring more providers to the community when there is acute hospital beds that they can refer to when they think the patient needs it. So as part of this new hospital, we are pretty sure we're going to have behavioral health beds. However, how many is very much dependent upon how we, plan it with the state together, because state has their own plan, and we will be asked by the state to have X number of beds versus us saying this is what we would like to have, right? So I'm pretty clear that the state is going to request that we plan as part of our new hospital to add behavioral health beds. And so the number we don't know, but we know for a fact that we will be having behavioral health beds. Does that answer your question?
Yes, thank you. Thank you.
You're welcome. You're welcome. If there's no other questions, there one more thing that I want to kind of bring it up. It's an elephant in the room. And so I better talk about it than you go home thinking about this. So there's a lot of concern about emergency room wait time in the community right now. And it is rightfully so. So in case you didn't know, the state of Maryland has probably the longest wait time in the entire country, actually, in ED, okay? And in the state of Maryland, Prince George's County has the longest wait time. So we are probably worst of the worst when it comes to emergency room wait time. And people ask me, why is that? Why can't you make it better? It comes down to a couple of different things. Number one, we have a number of ED treatment, we call it treatment bays, those cubicles that you go into when you come to emergency room. How many of them do we have in the county? We have less than other counties, other areas for one. But the second bottleneck of emergency room is because a good portion of those patients get admitted. When they don't have beds to be admitted, they're sitting in the emergency room. So if you don't have enough already, but it's being occupied by those who need to go and get admitted to the hospital, you're now operating with a lot less number of treatment days to see patients, right? And so because we lack acute care beds, and this is actually exacerbated by those what we call freestanding medical facilities or freestanding emergency rooms. There are a couple of them in the state, but two of them are in the county. Actually, I think there are a total of about 5 of them, and we got 2 of them. One is Bowie Health Center, the other one is Laurel. That used to be a hospital, is now freestanding emergency room. So on Northern County, they have more treatment days to see patients, but we don't necessarily have more inpatient beds to admit those who need to be admitted so that we can free up those treatment bays. I have to say, we have 14 treatment days, and our treatment days get utilized more so than any other treatment days in the country, I believe. On our heydays, we sold up to 47,000 with the 14 bays. Do you know how many bays do you need most to see 47,000? Somewhere around 50, 55, okay? And not only that, it's in the total of about 5,800 square feet. Some of you probably have a home that's bigger than that, right? So it's a very confined space in the woefully inadequate number of bays. And we admit a lot of them, but we don't have acute care beds either. So when we have to admit certain patients, we have to transfer them to other hospitals in the area. And that process is painfully long. We don't get to transfer patients any faster than 10 plus hours, actually. You gotta find the hospital that will accept the patient first. You gotta then call the ambulance, the transport to come to pick up the patient and send them up, to wherever the hospital is, if they have open and ready bed for them. So oftentimes we have patients sitting in the bays that are admitted but have nowhere to go. And I never forget, last January 3rd, I came to emergency department in the afternoon because they called me to say we're in a crisis day. And that day, 13 days out of 14 days had a patient in beds that were admitted that need to go somewhere. So we were operating that entire day with only one day, one open day. That's kind of why we're having the issues that we're having. And people say to me, hire more doctors and process them faster. Well, in that teeny tiny space, where are you going to put more doctors in there? Where are you going to put more nurses in there? So that's number one issue. The capacity is just inadequate beyond anyone's imagination. To give you some perspective about that, when we get to the new hospital, we're going to add more bays, but our emergency department is going to grow at least 5 to 6 times bigger in just square footage alone from where we are. We need more than 30,000 square feet, okay? So that's kind of the issue that we have. Then if you look at the staffing for the hospitals, so I was reading up on some articles because people are asking me a lot of questions. So Maryland is in the top 10 worst state for nursing shortages, right? In Maryland, actually Prince George's County has the worst shortages, which is very interesting. So we got all kinds of issues in the county. And this is where I get to have a pretty passionate discussion with the Department of Health in the county, as well as county executive to say, this has to be addressed. Every elected official of the county and everybody, every hospital, every healthcare system needs to work towards improving this together. We need to at least double or triple our capacity to right the situation. That's what we have to do. So we got a lot of work to do. I'm not proud of our ED wait time. We are working on different solutions. We're trying, if you come in, you may be asked to sit with 4 other patients in a room that we used to have for one patient. We put chairs instead of stretchers so that we can see more patients. And if you're waiting for results to come back, you're going to be waiting there where our staff can keep an eye on you while waiting, not out in the waiting room because something happens to you. We're very worried about that. And so we're doing all kinds of creative things to process our patients faster. But the challenges are not that easy to overcome. If I have more space, I can create more bays and do a lot of other things. The reality of it is we don't have a space to put more patients in ED. That's kind of the challenge that we have. So I just want you to know that we are working very feverishly to address the ED wait time. If you're in the community, I'm so sorry about that. I just want you to know that we're not sitting idle, but working towards improving it.
I think Beverly Ray was next with her hand.
Okay, everything cleaned up, sterilized.
This is Beverly Ray again.
No crap.
Oh, am I speaking over someone?
No,
Okay.
you're good now.
Okay, great. Thank you for highlighting that nursing shortage issue because are they regulations with regard to how many beds per nurses you should have or nursing assistants should you have per bed? And what is one of the ways to help with that? Could that be collaborating with the universities in the area? We have a number.
Absolutely. Thank you so much. There is no required ratio between number of patients and number of nurses or number of nursing attendant assistants. I know there's some discussions about it, but unfortunately, because our area is very challenged. So the shortage of nurses are not national issue. If you go to South, they don't have the same issue as we do. During the pandemic with the shortage of nurses, one thing that happened is the wage of nurses, nursing attendants went through the roof. In some cases, we're paying 3-4 times more than what we used to pay. Even then, we couldn't find them. So before the pandemic, there was a pretty steep wage gap between rural areas of the country versus urban areas of the country. And we are considered as urban area, right? So because of the wage gap, we were still able to attract nurses and keep them around. But this last wage increase has closed the gap between rural and urban area. So nursing attendants get $24 an hour, $25, $27 an hour. Here in Maryland or DC, they get somewhat similar hourly rate, probably identical hourly rate in small town North Carolina, South Carolina. So the dollars, they're stretched much better than our area, right? The rent for 2-bedroom apartment is probably $1,500. Here, you have to pay $2,500 to $3,000, right? So a lot of these things are playing so into this shortage to make urban areas to suffer more. And unfortunately, Maryland is, majority of Maryland is urban area. So that's where we are. The shortage is interestingly affecting the area. So if we, require to have some kind of ratio, unfortunate part of that is then we will have to cut the capacity down even further, because if the government or county requires that you can only have for every nurse 4 patients or 5 patients, if you go beyond, you have to just shut the door down to say, hey, we can't take anymore, right? Because you don't have enough nurses. So even before this all came about, I have been working with the Bowie State President, Dr. Braw, and the Prince George's County Community College President, Dr. Williams, to see what we can do to bring more nursing students down our areas to kind of start building the pipeline. We're doing international recruitment. We are getting some international nurses arriving. We're offering all kinds of sign-on bonuses. I mean, we have done so many things to recruit more nurses, but it is a battle, between all different hospitals. And then we're competing with other states to keep the nurses. Maryland lost a lot of nurses during the pandemic. A lot of them left the area to go to more rural or country-like settings. So at one point, the Board of Nursing president was asking us, 30,000 nurses didn't renew their licenses in Maryland. Do you know where they are? Can we trace them? That's kind of the scale of issue that we're faced with right now. We believe the answer is creating pipeline early on. And, remember, we got to open up a hospital with 5 times more needs for the people too. So I'm in a pretty difficult position for this. This is why we're very aggressively pursuing some of the options to address nursing or staffing shortages right now. We're approaching middle schoolers, high schoolers to rotate and get them interested in the career, giving them a scholarship, giving nursing students a scholarship to come to us. We're also creating a certified nursing attendant program within the company and having the entry level employees like EVS workers, housekeepers, or dietary staff to pursue nursing careers, so they become a certified nursing attendant. And then while doing that job, we send them to nursing school to become a nurse as well. So we're creating a lot of different tracks to build the pipeline for nurses, not just for now, but in the future, where we are going to need nurses at a mass scale.
Thank you.
Herb,
You're
did you have a
welcome.
question?
Yeah, just, and again, it is clear to me you are the right person for this job at the right time. No doubt in my mind about it.
Thank you.
For me personally.
Amen.
I think as I listened to you, you talked about capacity, you talked about waiting time, you talked about needed nursing, but you also talked about something that maybe we can do on our end in making sure this is a priority for the Prince George's County leadership. County Exec Alsabrook's office, but also on the state level, because the numbers that you outline are dismal.
Yeah.
And shouldn't be. And I think through your work and the work of this community and others, we can get those numbers to where they need to be. Okay, access to affordable healthcare, competent healthcare, waiting times, all that's important. I always say this, so I'm relatively new to the community. My parents lived out here, and that's one of the reasons I moved out here to take care of them. And I have to say, I was so taken back when I would go take them to their visits, etc. I could not believe it. Comparing where my wife and I go, Inova, I was like, what is going on out here in the county? So you're a breath of fresh air. We're going to hopefully, and I know our association will be working with you to support you in any way that we possibly can, because it's important. The healthcare in our area, the outcomes, the wait time, and having confidence in our healthcare system in Prince George's County. So I just wanted to leave you with that comment, but I see we have some other questions.
Yeah, very well said, sir.
I had a quick question, two questions. Based on everything you said in reference to the square footage and the number of bays, et cetera, how does the new facility compare to, and I know, one of the Virginia sites? I wouldn't even want to compare anything in Maryland, but how does it compare to a facility like Inova?
Inova or Virginia is a different state than Maryland. Virginia does not have to go through a process. We go through what's called the certificate of need to build a new hospital and create the capacity. If the company believes that there is a demand, they will just build a capacity. Here, we have to get an approval from the state as to number of bays, number of beds, and everything. And the state is in a position to say, we don't need additional capacity. I think it is true for some areas like Baltimore City, but not for Prince George's counties. So they have some formula that they work with to say, hey, according to formula, you're supposed to have this many, of certain things. One of the main challenges for Prince George's County is there are 5 health planning zones in Maryland. One is called Central, that includes Howard County, Anne Arundel County, Baltimore City, and everything north of there. And one is called Eastern Shore, the counties on the Eastern Shore. So one is called Western Maryland, north of Frederick is belonging to there. Then there's Montgomery County Health Planning Zone, because they have about 1 million people. Well, Prince George's County has about 70, 80,000 less than Montgomery County, but we're lumped into what's called Southern Maryland zone. So we are lumped with the Charles, St. Mary's, Calvert County together as a Southern Maryland zone. And so even we look at it that way, we're not enough, but what's really interesting is that they try to balance it at the state level, not necessarily at the area level. And so because we never had this before, and I was able to work with the county executive office to kind of address this issue. When they got the statistics, in conversations with me, they got upset. So they asked for a meeting with the Maryland HealthCare Commission, who does set number of beds and number of bays and so on and so forth. And their answer to the county's request was that, well, Prince George's County residents been out migrating to get healthcare all these years, and they're doing fine. So you don't need any more hospitals. By the way, you don't have good hospitals in the county anyway. So your residents don't like it, they go elsewhere. So, when I heard about that answer, I became pretty incensed. And I said, this is one of the most interesting answers that I ever got from anybody. And I know county had a lot more conversations after that. So there's a heightened awareness. But the bottom line is, though, the disparity is so severe. If we don't raise our voices, people probably won't hear about it. So at every chance you can have a discussion with your elected officials, I would encourage you to have those discussions. I've gone through probably from state Senate chambers to state House chambers to county council, everywhere that I could, including the federal senators and congressmen. I brought this issue of disparity to everybody that you can think of. I have probably had more discussions in the past 2 years that you can ever imagine. But I am hoping it will head somewhere because county executive is pretty bent on we're talking about this healthcare access issue at the state level. And I think she's trying to make it as bigger issues for the county. So that's an important thing. Another important thing that, if I may put a bug in your ear, so to speak, is I know there's a lot of conversations about, how to develop our area because, there's an interest to develop. But one thing I can tell you right now, I have doctors who are wanting to come and practice to serve the community, but there is no commercial building available for them to come in. So if we want doctors to be available, that's one of the things we must address. We have to have more commercial buildings available for physicians to come in at the right location to see patients. Otherwise, we'll continue to have to go away to get the care.
Thank you. Last question was, you mentioned multiple opportunities for people who want to go into nursing or certified nursing attendants. Do you have a website or anywhere where we could point people to, or?
Yes, our Adventist HealthCare website has, if you look at the looking for job or it has that information. If not, you are more than welcome to call my office, and we promote internally to have people go into that program, but we also recruit from outside as well to have people enter into the CNA Academy, we call them, and we pay them actually well in the program. And we have about 4 cohorts a year. That's how many we need.
Thank you.
You're welcome.
Okay, do we have any additional questions for President Shim? Okay, well, hearing none, we'd like to thank you for spending this hour with us, President Shim. We want to continue to work with you, whatever we can do from the association level to move this discussion forward. I think as I look at the upcoming political season, whatever you want to call it, this has to be on the agenda. I know to the extent if there's going to be any sort of civic association sponsors forums, we're going to make sure the healthcare issue is at the top of that agenda because it is important. We are deserving of the same level of healthcare that all the other jurisdictions presently have, and we're going to get that. Okay, so I don't have to talk to my residents in my community to say they go over to Inova, et cetera, et cetera. That is unbelievable because that's a long drive out to Inova off of 66, et cetera. So again, we want to thank you for spending this hour with us. We look forward to you coming out again to give us an update. Anything that we can do that you need from us, let us know. I know you very often have your staff reach out to me, and you're still having the advisory meetings with the community leaders. So we can bring that information back, but we look forward to having you back at the appropriate time that fits your schedule.
Well, thank you for the invitation again and your interest. Have a great evening, everybody.
Okay, thank you very much.
Thank you.
Thank you all,
Thank you.
everybody.
Okay,
Thank you.
bye.
Good night.
Good night, everybody.
Thank you.